Hi, this is Ben. Now let's move on to an important function of the kidney that students often forget about, the hormones. There are four important hormones released by the kidney. Three of them are endocrine hormones, meaning that they act where? At distant sites. And the fourth is a paracrine hormone, meaning that it acts where? Locally. The first is EPO, or erythropoietin. When the kidney senses hypoxia, the interstitial fibroblasts near the peritubular capillaries release EPO into the bloodstream. This goes to the bone marrow, which then stimulates the production of more red blood cells, which in turn will reduce the hypoxia experienced by the kidney. You can tell that this is somewhat of a feedback loop here. Overall, this is a very relevant fact for your exam, since this process can be significantly altered in the context of a renal cell carcinoma. We will go into more detail about these cancers later on, but just to give you a heads up, they can secrete EPO in an uncontrolled way, even if there's no hypoxia. So that one of the first ways they can be detected is an elevated hematocrit. What is it called when you have too many red blood cells? The name of this is polycythemia. It can be appropriate, as in a response to hypoxia, or inappropriate, as in a response to excess uncontrolled EPO production. Can you think of any other condition that might stimulate an increase in EPO secretion? That's right, COPD, or chronic obstructive pulmonary disease. This is a very common disease that is often tested on and often seen in clinical practice. These patients are in somewhat of a chronic hypoxic state, so their EPO levels tend to be increased. When this happens, we call it secondary polycythemia. The next important renal hormone is activated vitamin D, also known as calciferol. Inactivated vitamin D is synthesized in the skin from 7-dehydrocholesterol with the help of UV light, or can be taken up in the diet. Eventually, both the kidney and liver are needed to convert it to an active form. First, 25-alpha-hydroxylase in the liver has to convert vitamin D to 25-hydroxyvitamin D before the kidneys can convert it to its active form, 1,25-hydroxyvitamin D. Do you remember the enzyme that is responsible for this final conversion? Correct, 1-alpha-hydroxylase. And where is this enzyme produced? In the proximal convoluted tubule. Specifically, in the kidney, parathyroid hormone stimulates the production of 1,25-hydroxyvitamin D. What will this lead to? 1,25-hydroxyvitamin D will increase the intestinal absorption of both calcium and phosphate. Its action in the kidney is similar to its action in the intestine, and that it will help reabsorb filtered calcium and phosphate. The clinically relevant note is that renal failure can lead to decreased vitamin D production and subsequent bone problems. Do you know the term for this condition? Correct, renal osteodystrophy. Next, we have a paracrine hormone, which belongs to a group of hormones called prostaglandins. This picture is an example of a prostaglandin, which is synthesized from arachidonic acid. Like we said before, these act locally. Do you remember the roles prostaglandins have to play in terms of GFR and renal blood flow? Prostaglandins, specifically prostaglandin E2, vasodilate the afferent arterioles to increase GFR. Now, if NSAIDs inhibit prostaglandin synthesis, how might this affect a patient clinically? NSAIDs lead to vasoconstriction of the afferent arterioles and cause acute or even chronic renal failure because the kidneys will not be able to properly filter the blood if the GFR is reduced. Constriction of the afferent arterioles can also cause papillary necrosis and chronic interstitial nephritis due to reduced blood flow. So remember, renal papillary necrosis is an often tested complication of chronic NSAID use. One more important function of the kidney, just so we can be comprehensive, relates to biochemistry. It is that the kidney can perform gluconeogenesis, converting lactate and glutamine into glucose. The last hormone we will discuss is dopamine. It acts on the kidney in a variety of ways, many of which depend on the actual level of dopamine in circulation. Dopamine is secreted by the proximal convoluted tubule and promotes natriuresis. At low doses, it also dilates renal arterioles, thus increasing renal blood flow. However, at high doses, dopamine acts as a systemic vasoconstrictor, and it will constrict blood vessels throughout the body. Flash quiz. What are the effects of prostaglandins on the glomerulus? Answer. Prostaglandins cause dilation of the afferent arteriole and increase glomerular filtration rate. Remember that prostaglandins act locally as paracrine hormones in the kidney, and that NSAIDs will lead to constriction of the afferent arteriole by inhibiting prostaglandin synthesis.